Hi, I'm Dr. Chris Joyce. I'm a shoulder and elbow specialist out of Sky Ridge Medical Center. And I've got the pleasure of having one of my patients, Cindy, here today to talk about her shoulder.
I'm Cindy Young, and very, very fortunate to have met Dr. Joyce. It's been wonderful. He replaced my left shoulder in last September, over a year ago, and this shoulder, which was a replacement and reverse procedure, and he did that last December 22nd.
Well, thanks, Cindy. Cindy's definitely put in the legwork on this, but I'll talk a little bit more about the procedure. Cindy had two bad shoulders, so I did replace her left shoulder a little bit prior to this, but on her right side, you can actually see up here, this was her preoperative x-ray, and she had what we call a hemiarthroplasty, or a partial shoulder replacement, done I think about 7 years beforehand. And what had happened is, over time, the metal ball had actually worn away her socket to the point that there was really not much bone left there. And she had actually torn her rotator cuff as well. So we were a little bit limited in our options, but I was able to use actually a new implant. I think this is the first time this implant was used in Colorado. But it helped kind of achieve the goal that we needed, and it's called a reverse shoulder replacement. And I had to actually cement it in place here, but essentially what we did is we swapped where the ball and the socket were to make up for that bone loss and rotator cuff tear. And this implant's very nice, especially in somebody like Cindy that's a little bit smaller, because the biomechanics of the implant allows for better range of motion in the long term, and she's done great.
I'd like to encourage anyone that's contemplating this to find Dr. Joyce. He is awesome. I can't tell you how wonderful it is. I followed all of his instructions. Everything that he said, I did. And I feel fantastic. I've got almost, I think, 100% range of motion, no pain. I can do anything I want to do. I do work out 5 to 7 days a week, so I put in the work, and I had really good rehab therapy. So I just would like to encourage people to not hurt anymore.